MS-553 is a potent and selective inhibitor of protein kinase C beta, which is part of the B-cell receptor signaling pathway downstream of both BTK and PLC gamma 2. This agent, MS-553, is currently in a phase 1 clinical trial, and actually some preliminary data was presented last year at ASH that showed some really nice preliminary efficacy. Here we're showing some preclinical data, specifically in CLL models, both of treatment-naive patients and of patients who had relapsed after BTK inhibitors. Our initial hypothesis was that this might be an ideal agent for those patients who had progressed on a covalent and maybe even a non-covalent BTK inhibitor. Just by virtue of being downstream of BTK and PLC gamma 2, you would expect that even in the presence of those mutations, this type of agent would still work very well. And indeed, that's what our preclinical data confirms. We used cell line models to look at specific mutations associated with relapse on these agents, and we see very good inhibition of B-cell receptor signaling. We actually see inhibition of beta-catenin signaling as well in cell lines regardless of mutational status. Similarly, when we look to patient samples who had progressed on a covalent BTK inhibitor with C41S mutations, we see similar efficacy in terms of cytotoxicity, decreases in downstream signaling in terms of phosphorylation, as well as abrogation of CCL3 and CCL4 chemokine production. So just lending more support to this drug and this target as a potentially good target for those patients who relapsed after BTK inhibitors.